The new front door to dentistry and all of healthcare. Brought to you by MILA. Now, this presentation is all about prevention first, no insurance needed, no hidden cost, and just care that works. We're not the type that want to pull your teeth. In fact, the more we talk to patients, we find out so many dentists just want to pull teeth. We're all about saving them. But it's not just about your teeth. We know your teeth don't come alone without your mouth and the rest of you, your body, your health, and everything else that goes along with that. So today we're here to talk about MILA. It's a new way, and today, if you're seeing this video, it's for a reason. This is a very special opportunity and one that did not ever come by because I've been looking for it for the last over 6 years, and I am now creating it. You know, medicine fixes problems, but pre-care prevents them. You know, this has become far too personal because if you see the news stories, you know, there's so much distraction, so much politics, and so many unnecessary news stories. I think the most important thing we should all be talking about is our health. And no, not some silly thing that they've done, you know, on media that they can, you know, argue about. Let's talk about the facts. Like when all the cards fall, I think we can all agree the mouth is part of the body, and we should treat it as such. You know, there's these stories that you hear, like the 12-year-old Maryland boy that died after a tooth infection spread to his brain, you know, and his family struggled to find the care. Okay, or that 26-year-old truck driver that left his 2 daughters and wife because he just couldn't make it. He was on the East Coast and just couldn't make it back to Sacramento. And then Mike Williams, this happened fairly recently, and the title read, NFL football player dies from dental-related symptoms. So it's finally starting to get some recognition. People are talking about it, but I think we will all agree by the end of this presentation that dental is much more medical than we know. Now, I mean, you could take a screenshot of this if you like. I'm not going to go through the whole thing. It's not really that important, but we've come a long way in dentistry. You know, it was not too long ago, actually, that we have all of these inventions, like even Colgate toothpaste, and, you know, Novocaine, you know, painkiller that we know of, and fluoride being added to water. Right? This isn't something that we did for thousands of years. It's just very recent. And some of these chemicals, they only test it for like 4 or 5 years, but they take 10, 15, or 20 years to build up, or sometimes even generations. And then there's been some incredible advancements. If you have an electric toothbrush, you know, the teeth whitening exploded if you're on anywhere on social media. And now we have AI for dentists since 2010. They've had that for about 10 years, but what's very exciting is AI is coming to everybody else, right? I mean, everybody has heard of ChatGPT, but this is not about just AI. This is about using AI for all of the right reasons and in all of the right ways to reduce your costs, not make it, you know, more expensive and more fancier, but just making the health part make sense. So the way we're going to do that is there's a new kind of healthcare, and I firmly believe, like right now we have about 60 to 70, they used to say, but now that number has gone up to 70 or 80% of people in the U.S. are not regularly going to the dentist. Now I know that the past few years and the very unusual time has, you know, increased that number, and we may see that return back, but that still means that more than half the people, so in a group of 3, almost 2 of those people are not regularly going to the dentist. So this isn't about, you know, competing with or, you know, taking away from dentistry. In fact, I think dentistry is the last place of healthcare in the healthcare system that's actually left that performs health. But just like with anything, you know, there's dentists that believe in chemicals, scraping teeth, and, you know, just doing things the old-fashioned way, like they still believe in mercury fillings, neurotoxins, and fluoride. And then there's new dentists, they're using protocols that are proven very popular in Asia, Europe, and they're bringing those protocols fascinating protocols to reduce pain, increase the time, or reduce the time, but increase the completion and success rates, and lowering the failure rates of a lot of these different treatments out there. And so getting to what we do is we want to be that step before you ever go to a dental office, or if you went to a dental office that you don't really like and you just want to get your mouth clean without, harming your mouth flora, or anything else inside your mouth, and especially your teeth. Right? So it's a ozone water flossing. It's like a car wash for the mouth, but we call it O-Sweesh. So O-Sweesh is the name, and it kills bacteria, freshens breath, and it really helps to reduce inflammation and prevents a lot of that, cost. So the best thing about this is it's not just about a center where you can come in. Some people do, 6 months for cleanings, or every 3 months. You can come in every month if you'd like in our memberships, because there is no scraping, there is no toxic chemicals, and there's no harm. Right? It's only about resetting your mouth and refreshing your mouth, so that way you can have better health. And you get access to free virtual health planners available all the time. You have AI available 24/7, and you can get live virtual health planners. We have a non-profit that does this, and you get expert advice on your oral and overall health anytime. So not just that, you get a customized AI-powered X-ray report that has virtual dentist access. And the best thing about this is there's a home care system that we've worked on to develop, and it's already starting to come out. We already have the first piece of it, and there's other pieces that are going to be coming out as well. Because the goal is that we found that, yes, dentistry is a great place for healthcare, especially if you need that service, but there's too many old-fashioned or outdated treatment styles or harmful methods. And what we want to do is just elevate the care for everybody and provide all of the options for a patient. Regardless of whether we do that service in our practice or not, we want to offer all of the options, not only through our AI X-ray reports, but through our network. We have some of the top dentists that you could ever ask for. So, just because you're in a smaller city, or you're in a dental desert, or maybe you're even in a major city, but you have a dentist, or you heard of a dentist, or you'd like to get a procedure that is done well by somebody outside your area, in our network, our dentists can travel, or we can have you travel to them if that's what you want. And so we don't want to say it's the Uber of dentistry, because it does a lot more than that, but it makes it a lot more simple for patients to get the care that they want in the right steps. And so the old way was, you had a problem, right? You'd wait till you're in pain, and then you'd go visit a dentist, get a diagnosis, and in the past, you really didn't have a choice, right? I mean, they told you to brush and floss all the time, and every time you came in, it seems like they would beat you up and tell you that you weren't doing good on that front part where your tongue hits your teeth. I know it's not just me. I know everybody has an issue that, well, most people. And number two, you go visit a dentist, and you don't really have a choice, right? It's kind of like the old days where, they used to tell you people would go to a church and they wouldn't even have a Bible. You just have to believe the person that, was up in the front. And that's not a good way to do things, especially when it comes to your health. You know more about your mouth and your health than any doctor or dentist. Of course, they want to, be perceived as the expert, and some of these doctors and dentists are incredible. The experience and the wisdom, the knowledge that they have really is important. But I say that to say, you know your body and your teeth better than anybody. So you got to learn to trust that. And you didn't really have the choice before, because you just get the diagnosis, and then you just have the choice to accept treatment, right? Or if you don't like it, it's kind of like too bad, right? You get a second opinion, but you already paid about $200 to $300 at that point to get a free exam. To get an exam, because most dentists, the good ones anyway, they're not offering a free exam, right? And see, that's the problem. You can go to a lot of cheap dentists, and they'll do a free exam because they want to just push their treatment, pull teeth, and do whatever you can. But the thing about pulling teeth is that you can't undo that yet. I mean, they've even talked about regrowing teeth, but I don't think undoing pulled teeth is a thing. I don't think it's ever going to be a thing. But we'll see. You know, maybe there's something that comes out about that too. But here's the new way, and this is the MILA K way. And this is all about doing regular O-Sweesh cleanings, whether it's, you know, home care, and we actually show you how to do that, improve your home care, just like we do, you know, kind of like an insider secret inside dentistry. What do industry people do? What do holistic, biologic, and functional dentists and patients do? Not only do we have these dentists on our board and in our panel and in our network, but we'll start sharing more of this information as well, not just through our AI that makes all this information easily accessible, but through our directory and our network. You'll be able to access, search, and it's becoming easier and easier to get that experience. So again, this part of that, you know, I would say is the Uber of dentistry, but again, we do a lot more things than just, you know, getting the convenience of being able to find a dentist or the type of treatment when you need it. So then what happens after you get the regular O-Sweesh cleanings, you can, of course, at any time, you can opt for non-radiation and less harm or harm less ways to do exams and get, you know, records. So there's things like 3D models, 3D intraoral scanning, and of course, if you want to do like a CBCT, if you want to use any kind of radiation, you should probably go to the medical type of x-rays that a lot of these more advanced or top dentists are using, because they can actually see x-rays in 3D now, and it's incredible technology. These used to cost more than like a Lamborghini or Ferrari to get these, but the cost has come down tremendously. And so what used to be extremely hard to find in dentistry, a lot of the top practices are actually having that. So you want to get at least a dental practice with a pano, and that's kind of a question that you can ask your dental practice, or one of the checklists I would ask is that they must have at least a pano, which stands for a panoramic x-ray, and it's best if they have a CBCT, which is a cone beam, and then it's a computer tomography. It's a long, complicated word, but it's a very advanced 3D, very high detail x-ray. You can see not only your teeth, but you know, nerves and everything else. Okay, great. So once you get that, you can feed it through an AI, and it'll give you a personalized report. And so this way you don't have to trust what the dentist is saying. You can actually see for yourself and be educated and see simulations based on, it was 15 million, but I think it's 30 million scans now of teeth on what happens, you know, if they accept treatment, or what happens if you just ignore treatment. But of course this is just a simulation, but you know, it's just more education, and we can understand how to better, you know, take different diagnostics, like there's saliva testing nowadays, there's different kinds of x-rays that you can take, but a lot of that, there's healthy probiotics, there are, you know, advanced filtered water systems, which most people don't think of water with health, but it has a huge, tremendous part to it, and different dental tools that you can use at home that help you in between your dental visits or your O-Sweesh cleanings. And number two is if you ever need a dental issue, if you ever find yourself, and hopefully before you're ever in pain, we want to build more of a type of option where, of course, we can help those people that are very advanced, complicated, and complex that none of the other dental practices can help. That's actually what we've kind of been known to help recently, especially because we can get Medicare through these health planners that are also trained as medical billers, and using our AI, we can get Medicare and these health plans to pay what used to be extremely difficult and almost impossible to get medical plans and Medicare pay has become a lot easier with AI. So if you work with a health planner, they can discuss your options and help you to lower your patient portion. Many times we see up to 80% for Medicare, and sometimes I've even seen it all go away. But this isn't a promise, and the results aren't typical. I'm just saying that 99%, and they actually said it probably is 2% now, so 98% of dental practices aren't even credentialed with Medicare, and most of them do not have a medical biller or no long story short, you hire a health planner because they can set up a personalized plan for you. And the biggest difference is usually when you go to any part of healthcare, they don't really talk about it, no one really mentions it, but you get sold the stuff that they have there, right? And these places are all for profit, unless if you're going to a nonprofit charity, but meaning usually when you go to, usually like always, 99.9% of the time when you go to a dental practice or hospital, they're going to sell you on the treatment that they have or they've invested in that facility, or by the insurance plan that you're sponsored by or they're sponsored by, or if you're in a private practice, just what the provider happens to them. Because providers are very, we work with hundreds of them, they always want more patients, and to pay off the medical bills and stuff, it's just, long story short, they don't like to let patients go. Okay, so the best way is just to hire a health planner. They'll discuss your options and you can actually choose the treatment you want, because most people don't find out until it's too late, or they have some dental debt or regret that there's actually 12 different kinds of dentists. And so once you have done what you can do at home, you've done what you can do at the practice, if you want to learn more about stem cells, exosomes, or other very advanced healing options and solutions that you can do before pulling teeth, talk to a health planner, or come into one of the O-Sweesh centers, or just download the free guide. And of course, you can hire a health planner when it actually comes to needing any treatment, if you want to do any alignment, if you want to do anything surgical, cosmetic or surgical. And then when it comes to the dentist matchmaker, now you're properly set up because you have the information, you have the knowledge, but this really wasn't possible before AI. I mean, we were doing this, but the time it took was very concierge, and it was a very high cost. But now we are able to do this as a nonprofit for next to nothing, right, compared to all these dental plans. So as a founding member, and this is just the first time I'm actually recording this, and I'm just going to go with it. So yeah, in the world of AI, probably blabbing too much because it's way too late right now, but I just wanted to record this, get it out. And so I think this is the wrong order, but the point is founding members get a little bit more. And so here's what's going to happen is we will give you, it's just for the first 250 VIP founding member spots. Once they're gone, they're gone. We're only doing 250 founding member spots per location. Like if you've seen like how Chick-fil-A or some of these restaurants, they'll do like an opening day or opening week, and they give away, these huge packages. Well, we're doing a very similar program where we're locking in special VIP founding member bundle, and it's just $4.99 as an annual membership. And what this gets you is you can come in as often as a month, every month if you want, for an ozone water flossing, which is a professional premium cleaning and detox for your mouth, of course. You get free digital x-ray and an AI report. That alone, I mean, I know people will pay $250 to $350 just for the x-ray, not even including the AI report. So you get one of those, and then lifetime price lock. I think that's the biggest thing, because as soon as we launch these, and we've already been talking to a lot of other dentists that like what we are doing, and hygiene is notoriously expensive to pay a hygienist to clean your teeth. If they scratch them, they use toxic chemicals. So we are training a whole new class, a whole new army of new O-Sweeshers, and there's no sharps, no chemicals, and this is just really about teaching people how to use things like a water flosser or an O-Sweesh device, a home care device, at home safely, and with the best results. Okay, so when it comes to this membership, there's a couple of the benefits that you'll get. With the founding member pass, you'll get an exclusive shirt, you get some exclusive gear, a gift bag from us and some of our sponsors. You get a 3D scan. When you actually come into one of our practices, you can redeem a 3D scan anytime within that year, of course, and then one ticket to a virtual event. We were charging $10 for early bird tickets and up to $125 for dinner tickets for our live expo. We're going to be doing many more of these. Some of them are, the dinner show, and they got all the vendors. Some of them are just, home parties. I think we'll start to have people have expressed interest in wanting to do those. But the virtual events are done by MILA. So you'll get one ticket to an official MILA virtual event, and then you'll get 3 friend passes as well that you can give away or share with, don't give it away, share it with a very special friend or family member or someone that you really care about and love dearly. These are, a $49 value each to just come in and get a cleaning, so we'll give you 3 of those as well. You get exclusive invites, member pricing on not just our services, so if you need any dental care, we have a very low pricing schedule. Everybody that's seen our pricing schedule, and I think this video is going to get really long if I try to put it in, so if you're interested, you can see it. It's on our website. But you can get member pricing and a vetted dentist directory, and I think that's kind of the biggest value there. So there's a couple ways to join. You can do the individual plan, the couple plan, or for families. The great thing about the family plan is if you are a family and this just works for, you gotta be a family. It's not like cousins, right? It's just in your direct family. It's for 2 adults and any children under 12, right? So that's gonna cover that as well. Right now, for the first 250 members, there's a $99, call it an application or an intake fee, the first exam fee. It's waived for this promo, and that's it. If you just join one of the annual plans, you get locked in with all of the benefits we talked about. If you choose to want to start off with a monthly plan, you can do that as well, but you may miss out on one of the founding members spots. So, things that make us a little bit different is, just to explain in a different way, we have these virtual dentist consultations, so whether you want to talk to an AI and just chat with it, everyone knows of ChatGPT, I think, nowadays, but what about the next step? What if you kind of chatted and now you kind of know what you want to talk about? We can do a virtual dentist, or you can, of course, come into one of our locations and talk to a dentist directly. And then, of course, accurate treatment planning. So we're going to do it not just driven by AI, but we'll give you all the options, not just what we have at our practice, but if you went to the top providers. We have an expansive network, so we'll show it to you all, and you get to choose based on what's best for you. And then we have special member pricing and exclusive events and discounts on products and services. So get an O-Sweesh cleaning. It's the first professional mouth cleaning that kills virus, bacteria, and fungus without the pain, toxic chemicals, or shutters. And that's what this is all about. I probably should have had this slide in the front, so I'll probably do it again later on. But for now, we'll just deal with this. Traditional cleaning scrape, polish, and often irritate your gums, but they don't eliminate bacteria at the source. Once you get an O-Sweesh cleaning, and I know I'm a little bit biased, but this is what our patients are telling us. And I tried the O-Sweesh myself, but I didn't get a professional cleaning until some of our patients were doing it, and they were giving us such great responses, because I have the home unit, that I asked for my partner to do a professional O-Sweesh for me too. So you can just think of this as a reset for your mouth. That's basically it. We do have this home device, so if you are not in one of our locations and you want to join, there is a limited time offer for a special founding member pricing right now. It's normally $149 what we sell it for. It's our MILA pricing that we have, and founding members can save even more. So I think it's like we'll use the code HSFM when you go to osweesh.com/Flosser, and actually I think it's 125. But when we run out, the price goes back up to normal, 149. The retail price is actually 249. This is worth every penny of it. We shrunk down an entire ozone generator machine into this tiny, portable, travelable, chargeable device. It's great. It just needs one of the USB-Cs, which I think every Android and Apple uses now. So it's just one of those chargers. Here's another view. I think this is getting a little long-winded, and I see some Latin in the corner, so I clearly got to update this slide. But we're one of the few Medicare certified dental practices, and we accept all dental insurances and even Medicare and health plans too. Even if you've been to a dentist, you have a dentist that you prefer to go to, and you you want to come stop by us to see other options, or you know you want to stick with that dentist, but you just want us to help you get reimbursed or get your money back from these Medicare health plans, again, stop by one of our O-Sweesh centers or download our AI app coming out, and you'll be able to do this all virtually just from your phone or in one of our centers. We have computers set up that you could just come in and use. We have monthly, the mouth cleanings. We have health planning. It's a process, right? We'll give you a customized report. Access to the top dentists. It's like that, what was that, where the banks compete for you? I forget, but you get the point, right? So that's kind of what it is. Like, we have all the top dentists, and, you know, we're creating the Uber for that, in that sense. But I think it's probably better to say it's more like an Orange Theory, or like a dry bar for dentistry, but where you can come in, you know, just like Home Depot, and buy products and services too. So it's not, you know, just the service, but, you know, it'll be both. And so you get all of that. Okay, so whether you want to talk to a health planner or a dentist before your visit, you can. I'm not going to be taking too many calls, but I still take some now. But I've just kind of been working on, I've definitely been working on this with MILA directly, and Jim Zhang is one of our dentists, but we have a few other dentists on our board as well. So as a MILA member, what you do is it's very simple. You just, as a member, you book your next cleaning, pick your spot, and if you pick your spot early enough, we can get you, you know, just that same spot that you want, same time. And it's not a standard dental cleaning. You know, we're not going to be polishing your enamel off, scraping your teeth, or, you know, using fluoride. Unless if you want to, you can bring that stuff in and we can help. And of course, I mean, we already have the tools. But this is an O-Sweesh cleaning. It's a car wash, and if you do this regularly, what we've found is after just 30 days of this kind of home care, we're seeing incredible improvements in the mouth. Things that have taken years to get there are coming back, and the inflammation is going away in just, you know, 30 days, 60 days. So that leads into upgrading your home care. It's not just about, you know, upgrading the way that you do things, but maybe, you know, some people are good, some people maybe they need an upgrade. So, you know, we could talk about that, talk about the different options, and, you know, you just don't know what you don't know. So that's what we can help you do. You can pick up a brochure, you can watch some of the videos if you want at your own pace and at your own time, and just learn what, you know, some of the healthy, happy, healing people. There's some people with like rock hard, incredible teeth, and there's some people that have problems with their teeth all the time. And what we found is there's things that these people with rock hard, incredible teeth are doing, but it's things that they or other people took for granted. But you know, as we talk to enough patients, we find out that there's actually a formula, or there's actually like a lifestyle for this. Okay, and then very last is, if you ever want to, or you could even do it first, you could talk to a health planner, and that gets you access not just to a medical biller, not just to professional dental consultations, not just to AI reports, and all of that, right? So you can use the pre-care AI that's coming out, or again, you can visit one of our centers. Here is our contact information. We have our practice information there. We have 2 practices right now that are fully up and running, a couple more that we're talking to, and a few practice groups that, at the end of the day, what we want to do is we want to invite as many, not just members, but affiliates and ambassadors that see this vision. We've been working on this project for the greater part of a little over 5 years now, and it's now time. We've gotten the resources, we've gotten the connections, and we have our own custom AI and products, services that nobody else has on the planet. So we're ready, we're excited to share it. We're so happy and excited that the other patients are experiencing an O-Sweesh and they're loving it. We already know that the MILA or the health planning and the medical billing service is successful because we've been doing that for over 10 years now in our practices and others. But we're very excited to invite you. If you want to grab one of your founding member spots, if you're watching this video and you know somebody in San Jose, Santa Clara, Silicon Valley, California, it would be awesome if you could share this video, because this isn't going to last forever, and once these 250 founding membership spots are gone, they're gone. You're going to get one of those spots by going to yesmilak.com/FM. And what do you do if you're not on in that area? So we have two things. We have yesmilak.com, and if you go to / and it's City Hunt. If you want to add your city, if you want us to come to your city or by where you are, we're going to have a race for it. We already have some dentists that have wanted to put up locations, but the way we thought to make it fun, kind of make it like a game, like a competition, let's see what city is healthier or wants to have these Yes Mila K centers or these O-Sweesh centers in their city. So it's very simple, it's free to sign up, sign your city up, and we will be prioritizing those cities that have the most signups, of course. Okay, so what other patients are saying. Looks like that video is not working. The names are protected for their patient privacy, but one of our patients went to 6 other dentists before ours, and they were hesitant at first, but when they saw that we were focused on saving teeth, they actually heard it from a friend of theirs, they really wanted to come by, and so they set up a treatment plan. We actually just saw the patient earlier today, accepted treatment, but not just that, they're so happy that they found O-Sweesh, because we provided them other options where they didn't have to pull all of their teeth, and there was a lot of things that we could do to actually save most of the teeth that the other dentists were saying that they needed to remove all of them, which is a really scary thing, to go from having your teeth to not having them. And then another person that we trying to protect the names for privacy, but another vendor in the dental industry said that they didn't really think that they need dental, but when they were working at home a lot, and maybe they changed their lifestyle, they found themselves needing an implant, and they found finding like a holistic, healthier dental practice was a lot harder to find than they thought. So, he got a metal implant, but had he had known, he would have gotten a ceramic one. There's tooth-colored dental implants that you can get as well. So again, we could talk about all that, but just remember, I'm done with this one. Got to change that too, but health starts from the mouth. If you want to grab a founding member spot, you can do it at yesmilak.com/FM. Thanks, and we'll see you on the next video.